Hi, my name is Dr. Kimberlee Musser. I'm the Chief of Bacterial Diseases here at the Wadsworth Center, New York State Department of Health. I've been here almost 27 years now. In my current role as the Chief of Bacterial Diseases, I oversee a staff of 60 people, a number of directors, supervisors, lab technologists who are doing testing for bacteria. We receive bacteria from all over New York State. We're trying to understand outbreaks and doing testing to compare foodborne sources, environmental sources to the bacteria from clinical cases so that we can solve outbreaks. One of the agents that we do quite a bit of testing for is Mycobacterium tuberculosis that causes TB. When I started here as a postdoc, we had only 2 molecular tests to identify bacteria, and since that time we've brought on about 120 diagnostic tests that we utilize every day for the characterization, detection, and the drug susceptibility understanding of these bacteria. The resource that we have available here at Wadsworth Center to really help us do our jobs well is just incredible. And specifically for tuberculosis, for the last 20 years we've been bringing on molecular tests that really make a difference because those bacteria grow so slow. So being able to detect and understand how to treat those bacteria is critically important. We have, in the last 10 years, we're the only state that's been doing clinical whole genome sequencing of Mycobacterium tuberculosis. Every single week, we test about 20 to 30 cases that have TB disease. We do this cutting-edge methodology to sequence the whole genome. We can understand all the details about those bacteria. We can understand exactly how to treat them and how that case may be related to other cases in New York and across the country. The people are incredible. Everybody who works here will talk about the fact that they're here in this role. They didn't take this job for the money, for the status. This is about wanting to do something to help the community. We really are trying to think of what is the next thing that we can do, what is important for rapid and cost-efficient diagnosis so that we can get the most information out of every test that we provide. By being able to do this work so much faster, maybe months faster than some of the traditional testing that's done across the country, we're able to really give that information quickly to treat patients and stop the spread of TB disease here in New York State.